Hello, I'm Judson Brandeis, board-certified urologist and Hive 80 member. The following content was created by the Urology Care Foundation. The prostate is part of the male reproductive system. It's about the size of a walnut and weighs about an ounce. The prostate is found below the bladder and in front of the rectum. It goes all the way around a tube called the urethra, which carries urine from the bladder out through the penis. The prostate's main job is to make fluid for semen. During ejaculation, sperm is made in the testicles and moves to the urethra. At the same time, fluid from the prostate and the seminal vesicles also moves into the urethra. This mixture, called semen, goes through the urethra and out through the penis. When the prostate is enlarged, it can bother or block the bladder. Needing to urinate often is a common symptom of Bph. This might be every 1 to 2 hours, mainly at night. Other symptoms include feeling that the bladder is full, even right after urinating, feeling that urinating can't wait, a weak flow of urine, needing to stop and start urinating several times, trouble starting to urinate, trouble stopping urinating, and needing to push or strain to urinate. If Bph comes severe, you may not be able to urinate at all. This is an emergency that must be treated right away. Now, how can Bph affect your life? In most men, Bph gets worse with age. It can lead to bladder damage and infections. It can also cause blood in the urine and kidney damage. The causes of Bph are not well understood. Some researchers believe that factors related to aging and the testicles may cause Bph. This is because Bph does not develop in men whose testicles were removed before puberty. Throughout their lives, men produce both testosterone, a male hormone, and small amounts of estrogen, a female hormone. As men age, the amount of active testosterone in the blood lowers, leaving a higher share of estrogen. Studies have suggested that Bph may happen because a higher share of estrogen in the prostate adds to the activity of substances that start prostate cells to grow. Another theory points to DHT, a male hormone that plays a role in prostate development and growth. Some research has shown that even when testosterone levels in the blood start to fall, high levels of DHT still build up in the prostate. This may push prostate cells to continue to grow. Scientists have noted that men who do not produce DHT do not develop Bph. Aging and family history of Bph increase a man's risk for Bph. Obesity, lack of staying active, and erectile dysfunction can also increase the risk. Now, can Bph be prevented? There is no sure way to stop Bph, but losing weight and eating a healthy diet that involves fruits and vegetables may help. This may relate to having too much body fat, may increase hormone levels and other factors in the blood, and stimulate the growth of prostate cells. Staying active also helps control weight and hormone levels. As for diagnosis, see your doctor if you have symptoms that might be Bph. See your doctor right away if you have blood in the urine, pain and burning when you urinate, or if you cannot urinate. Your doctor can diagnose Bph based on personal or family history, a physical exam, medical tests. The American Urologic Association has built a Bph symptom score index. It's a series of questions about how often urinary symptoms happen. The score rates Bph from mild to severe. Take the test and talk with your doctor about your results. Your doctor will review your symptom score and take a medical history. You'll also have a physical exam that involves a digital rectal examination, which is an uncomfortable but very important exam. Your doctor may also want you to have some or all of these tests: a cystoscopy, where we look at the urethra or bladder with a scope; a post-void residual volume with an ultrasound to measure urine left in the bladder after urinating; a Psa blood test to screen for prostate cancer; an ultrasound of the prostate to assess size and shape; a urine analysis; a uroflow to measure how fast urine flows; and urodynamic pressure test to test pressure in the bladder during urination. Now, the Psa blood test. PSA is a protein that is made only by the prostate. When the prostate's healthy, a very little PSA is found in the blood. The PSA blood test measures the level of PSA in the blood. The test can be done in a lab, hospital, or doctor's office. No special preparation is needed. The PSA test should be done before the doctor does a digital rectal examination, and you should not ejaculate for 2 days before the PSA test. That's because ejaculation can raise the PSA levels for 1 to 2 days. A low PSA is better for prostate health. A rapid rise in PSA may be a sign that something is wrong. Bph is one possible cause of a high PSA level. Inflammation of the prostate, or prostatitis, is another common cause of a high PSA level. Digital rectal examination is done with the man bending over or lying curled on his side. The doctor puts a lubricated gloved finger into the rectum to feel the shape and the thickness of the prostate. The DRE can help your doctor find prostate problems like prostate enlargement, prostate infection, and prostate cancer. There are many options for treating Bph. You and your doctor will decide together which treatment is right for you. Mild cases may need no treatment at all. In some cases, minimally invasive procedures, surgery without anesthesia, are good choices. And sometimes a combination of treatments work best. The main types of treatment for Bph are active surveillance, prescription drugs, less invasive surgery, more invasive surgery. But let's talk about active surveillance first. Often Bph will only require surveillance. If you and your doctor choose this treatment option, your Bph will be closely watched but not actively treated. This means that Bph is monitored with regular visits to your urologist. A yearly exam is common. Your healthcare provider will look for worse or new issues before suggesting anything else. Diet and exercise are often recommended as a way to prevent or manage your symptoms. Active surveillance is best for men with mild to moderate symptoms. It is also an option for men who are not bothered by the effects of Bph. If your symptoms get worse, or if new symptoms appear, your doctor may suggest that you begin active treatment. Now, what are prescription drugs? One class of prescription drugs are alpha blockers, which relax the muscles of the prostate and bladder. They improve urine flow, reduce blockage of the urethra, and reduce Bph symptoms. They do not reduce the size of the prostate. Men with moderate to severe Bph and men who are bothered by their symptoms are good candidates. Alpha blockers are not a good choice for men who are about to have cataract surgery. They can cause something called floppy iris. Make sure you let your ophthalmologist know that you are on alpha blockers. These prescription drugs are taken by mouth. Alpha blocking drugs include alfuzosin, doxazosin, silodosin, tamsulosin, and terazosin, also known as Hytrin, Cardura, Flomax, Rapaflo, and Uroxetrol. Side effects may include dizziness, lightheadedness, fatigue, and trouble ejaculating. One benefit of alpha blockers is they start to work right away. Another class of medication are the 5-alpha reductase inhibitors, which block the production of DHT, a male hormone that can build up in the prostate and may cause prostate growth. They shrink the prostate, increase urine flow, and reduce the risk of BPH complications. They also make it less likely that you will need surgery. These drugs may be best for men with very large prostate glands. These prescription drugs are taken by mouth and include dutasteride and finasteride, also known as Proscar and Avidar. They may take months to become fully effective. The side effects include erectile dysfunction and reduced libido or sex drive. You must keep taking the pills to prevent symptoms from coming back. Combined therapy, an alpha blocker and a 5-alpha reductase inhibitor are used together. Men with larger prostates are good candidates for this treatment. Alpha blockers and 5-alpha reductase inhibitors may work better together than either drug does alone. They improve symptoms and prevent BPH from getting worse. Possible drug combinations include finasteride and doxazosin, dutasteride and tamsulosin, which is a combination that's available in a single tablet called Jalin, alpha blockers and antimuscarinics. A urologist may add antimuscarinics for patients with overactive bladder symptoms. Overactive bladder is when the bladder muscles squeeze uncontrollably. It leads to the frequent and urgent need to pass urine. It can lead to incontinence or leakage. Antimuscarinics relax the bladder muscles. Side effects may happen with each drug. By taking 2 drugs, you may have more side effects than if you were just taking 1. Some side effects in patients on combination therapy were dizziness, erectile dysfunction, weakness or lack of energy, and a drop in blood pressure when moving from a sitting or lying down position. Phytotherapies are herbal treatments, but they are not prescribed by a doctor, but are sometimes a form of self-treatment. Men buy them over the counter as a dietary supplement. One popular herb is saw palmetto. However, several important studies show that saw palmetto does not work. A supplement called beta-sitosterol has been shown to work, and supplements with beta-sitosterol may be a first step before progressing to pharmaceuticals. The quality and purity of supplements do vary, and make sure that you're using a reputable company that produces these supplements. Less invasive surgery. Minimally invasive or less invasive surgeries require only tiny cuts or no cuts to the body. Good candidates include men who have taken BPH medications that did not work, or men with the following symptoms: weak stream of urine, straining to pass urine, urinary tract obstruction, bladder stones and/or blood in the urine, incomplete emptying, and bleeding from the prostate. They can be done as an outpatient without a stay in the hospital. Recovery time is usually quicker. They can offer relief from symptoms, including urinary control problems. On the other hand, they do not reduce your risk for another surgery. Side effects for having certain types of minimally invasive surgery is increased risk you'll need to have another surgery or need to go back on medications. Other temporary side effects may include blood in the urine, burning when you pass urine, needing to pass urine more often, sudden urges to pass urine, urinary tract infection, less often, erectile dysfunction or retrograde ejaculation, which is semen flowing backwards into the bladder instead of out of the penis. Choosing the right type of surgery for you may depend on the size of your prostate, your overall health, and your personal choice. Some types of surgeries are not recommended to include prostate artery embolization and transurethral needle ablation. We do not recommend these 2 procedures. Yet, there are many types of less invasive surgeries your doctor may suggest. These include the prostatic urethral lift. The prostatic urethral lift uses a needle to place tiny implants in the prostate. These implants lift and compress the enlarged prostate so that it no longer blocks the urethra. Prostatic urethral lift may be done with either local or general anesthesia. The prostate urethral lift uses no cutting or heat to destroy or remove prostate tissue. It takes less than an hour and can usually go home the same day. Most men see symptom improvement within about 2 weeks. Flow rates tend to be better than with TURP. However, men who undergo prostate urethral lift tend to be very pleased with the less invasive procedure. Some men may have pain or burning when passing urine, blood in the urine, or a strong urge to pass urine. These side effects usually go away within 2 to 4 weeks. Many men have fewer sexual side effects after prostatic urethral lift than after other types of prostate surgery. Men with many medical problems may be good candidates. Men for whom surgery is high risk may also be good candidates. Many men with enlarged prostates and urinary symptoms may be good candidates for prostatic urethral lift. Men who have prostatic urethral lift can still have other treatments if they need it, including MRI, TURP, etc. If you are allergic to nickel, titanium, or stainless steel, talk to your doctor before getting a prostatic urethral lift. Current studies have evaluated 7 years of treatment with the prostatic urethral lift, and future studies may help to determine long-term durability. Another non-invasive treatment option is water vapor thermal therapy, also known as Resume. This treatment uses water vapor or steam to destroy prostate cells squeezing the urethra. Inside a handheld device, sterile water is heated just above the boiling point when it turns into steam. A precise dose of thermal energy from steam is then injected into the prostate with a small needle. The release of this thermal energy causes rapid cell death. The body's natural healing response then breaks down and removes the dead tissue, causing the prostate to shrink. The treatment is done in the doctor's office with local anesthesia, or after you've taken a pill for pain. You may have blood in the urine and need to use a catheter for a few days. Painful or frequent urination should go away within about 2 to 3 weeks. Sexual side effects, such as erectile dysfunction, are unlikely. Studies currently suggest that symptom improvement lasts for at least 5 years. It's not currently known whether the treatment continues to work long-term, beyond the 5-year point, or whether patients eventually need to have additional treatment. Men may be good candidates if they do not want to take medications for BPH, or if they have tried medication and found that it did not work. Unlike other less invasive therapies, this therapy can treat men who've had a middle lobe of the prostate. Men who prefer not to have surgery or may want to avoid sexual side effects, they may also be good candidates. Transurethral microwave thermotherapy, or TUMT, uses microwaves to destroy prostate tissue. The urologist threads a catheter through the urethra into the prostate. A device called an antenna sends microwaves through the catheter to heat selected portions of the prostate. The heat destroys excess prostate tissue. A cooling system protects the urinary tract from heat damage during the procedure. TUMT does not require general anesthesia. The surgeon numbs the skin and gives you a pain pill. TUMT only takes an hour. It may relieve bladder obstruction. There is little blood loss or fluid absorption. You can usually go home the same day. TUMT poses a low risk of side effects, such as urinary tract infections, urinary incontinence, and scarring in the urethra. Some men have symptoms to include frequent or intense urges to pass urine and a burning feeling when passing urine. Newer therapies have largely replaced this practice. Men with too many medical problems for invasive surgery may be good candidates for TUMT. Men with weak hearts may be good candidates because there is minimal blood loss. So are men who want to avoid anesthesia. Catheterization. Catheterization uses a tube called a catheter in the bladder to drain urine. Catheters can be placed through the urethra or via a small puncture in the bladder just above the pubic bone. This option is helpful for men with bladder control problems and a blocked prostate. Still, catheters' benefits are temporary. There are two types of catheters. The catheter may be clean, which means it is placed and removed every 6 to 8 hours, or it may be indwelling, which means it is left in the bladder for a short or long time. Side effects of using catheters may be infection. When a catheter is in place for a long time, bacteria can stick to the catheter surface. This makes it hard for the immune system or antibiotics to work. Using a catheter for a few years increases the risk for bladder cancer and can destroy the tissue of the penis. This is probably due to the long-term irritation caused by the catheter sitting in the bladder or at the meatus. The risk of infection and cancer is lower with clean, intermittent catheterization than with an indwelling catheter. Good candidates for using catheters include men who are waiting for medication to work or waiting for surgery. Catheters are also used during treatment for an infection. They may be a good choice for men who have had many medical problems and for men toward the end of their lives, when surgery is not advised. More invasive surgery. In severe cases of BPH, when other options fail, more invasive surgery is recommended. More invasive surgery is best if you are unable to pass urine, have kidney damage, have frequent urinary tract infections, have a lot of bleeding, or have stones in the bladder. There are several options. The best option will depend on your health, your doctor's expertise, and your personal choice. But let's talk about the types of more invasive surgery. There's the transurethral incision of the prostate, or TUIP. TUIP may be used if you have a smaller prostate, but still have major blockage of the urethra. Instead of cutting and removing tissue, TUIP widens the urethra. The surgeon uses a laser beam or an electrical current to make small cuts in the bladder neck, where the urethra joins the bladder and in the prostate. This reduces the pressure of the prostate on the urethra and makes urination easier. A catheter is left in your bladder for 1 to 3 days after surgery. The hospital stay is 1 to 3 days. TUIP may improve the ability to pass urine. It may ease symptoms. Temporary urinary retention, urinary tract infection, dry orgasm, incontinence, and erectile dysfunction are possible side effects. Some men need additional treatment after TUIP. Men who have a smaller prostate or do not want a more complete prostate resection but need surgery are good candidates for TUIP. The procedure is less likely to interfere with ejaculation than the more substantial TURP. Photoselective Vaporization, or PVP. PVP is a very common surgery for BPH. In PVP, or green light laser, the surgeon guides a thin tube called a cystoscope through the urethra to the prostate. Then the surgeon uses a laser to destroy obstructing prostate tissue and stop bleeding. PVP is done as an outpatient procedure at the hospital or sometimes in the doctor's office. Most men can have a PVP without adverse events. There is little bleeding and few side effects. After PVP, you can often stop medical therapy for BPH. Good candidates for PVP include men with small to moderate-sized prostates and those with too many medical problems for more invasive surgery. Men with weak hearts are also good candidates because there is no blood loss. So men who want to limit anesthesia. Men with higher risk of bleeding, such as those taking blood-thinning medications, may also be good candidates for PVP. Transurethral resection of the prostate. TURP is a very common surgery for BPH. After anesthesia, the surgeon inserts a thin, tube-like instrument called the resectoscope through the tip of the penis and into the urethra. The resectoscope has a light, valves for irrigating fluids, and a thin wire loop. An electrical current is passed along the wire. The surgeon uses the electrified wire to cut away the prostate tissue that is blocking the urethra and seal blood vessels. The removed tissue is flushed into the bladder and from there out of the body. You will need to use a catheter for 1 to 2 days after the procedure. This treatment has well-known long-term outcomes. Other treatments are generally compared with it. It is considered the gold standard treatment for BPH. Symptoms generally improve markedly. Its effect of treatment lasts for more than 15 years. TURP does not remove the entire prostate. No incisions or cuts are needed. The hospital stay is 1 or 2 days or until there is no significant blood in the urine. TURP does require anesthesia. As with any surgery, anesthesia poses a risk. Side effects of TURP may include retrograde or dry ejaculation, erectile dysfunction, urinary tract infections right after surgery, and urinary incontinence. Full recovery takes about 4 to 6 weeks. Men who require surgery because of moderate to severe BPH symptoms may be good candidates for TURP. Another option is the holmium laser enucleation of the prostate, or HOLEP. In HOLEP, the surgeon places a thin, tube-like instrument through the penis into the urethra. A laser is inserted into the resectoscope and destroys the excess prostate tissue. No incisions or cuts of the skin are needed. You may only need to stay 1 night in the hospital, and there is usually very little bleeding. The catheter is used, but it's usually removed the next day. You may have blood in your urine or frequent or painful urination for a few days. This treatment requires anesthesia. Men having HOLEP have more post-op stress urinary incontinence issues compared to other surgeries, but this improves over the course of 1 year. As with any surgery, anesthesia poses a risk. Men with larger prostates who wish to avoid more invasive surgery may be good candidates for this treatment. Men with a higher risk of bleeding, such as those taking blood-thinning medications, may also be good candidates for HOLEP. After treatment. For most men, symptoms of BPH improve after treatment. Infection, bleeding, incontinence, and erectile dysfunction may occur after some treatments. In some cases, scar tissue may form. What are the long-term side effects of treatment? Side effects vary with the type of treatment you choose. Most side effects are temporary. It may take a while for sexual function to fully return. Most experts agree that if you are able to have an erection shortly before surgery, you'll probably be able to do so after surgery. Most men find little or no difference in orgasm, but you may have retrograde ejaculation, when semen enters the bladder rather than being sent out through the penis. For most men, side effects lessen with time. Some treatments may cause long-term side effects for some men. So how can you prevent a recurrence of BPH? Once you've been treated for BPH, taking medication can prevent symptoms from returning or getting worse. Some men may need additional treatment. Some men need repeated treatment to get rid of bothersome symptoms. In older men, it may be possible to control BPH symptoms to the end of life. This is Dr. Judson Brandeis, urologist and Hive 80 member. Thank you for your attention. Tune back in to Hive 80 for continual medical and wellness information. Wishing you the best of health.